Okay. Powell is not here yet. Hoffman?
Present.
McGilvray?
Here.
Jackson is absent with notice. Nelson?
Here.
Cavell?
Here.
Gingell is absent with notice. Kuhn?
Here.
Lubes?
Here.
We have a quorum.
Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item on the agenda is approving the minutes from October 11th. I have a motion by Commissioner Nelson, support from Commissioner Hoffman. All in favor say aye.
Aye.
Opposed? The minutes are approved. We move on to approving the agenda. I have a motion by Commissioner McGilvery, support from Commissioner Nelson. All in favor of approving the agenda say aye.
Aye.
Opposed? The agenda is approved. We move on to our first public comment of this meeting. Public comment is for items on the agenda. Is there anyone from the public wishing to comment at this time? Public comment is closed. We move to communications. We have one item under communications, the intake disposition report from September 2022. I have a motion by Commissioner Nelson to accept the communications and support from Commissioner McGilvery. All in favor say aye.
Aye.
Opposed? Communications is accepted. And we move on to presentations. So our first presentation is from the Gary Bernstein Community Health Clinic. So, thank you. Yes, you will head to the front of the table and we'll begin our presentation.
Good morning, everybody.
Good morning.
And thank you for having me out here. So because you're the Public Health and Safety Committee, I wanted to come and talk with you a little bit about the Gary Bernstein Clinic because we're a wonderful resource in the community and we're still getting out there and letting people know about the services that we provide. So we are a free healthcare clinic for individuals 18 years of age and older who are uninsured. But we are also a free healthcare clinic for, let's say, senior citizens who may have health insurance for their hospital and doctor, but they have nothing for dental or eye care. So if you are not insured for the service we provide, we can still provide that service for you. In addition to that, for those individuals who may be purchasing insurance on their own or from the market, the healthcare marketplace, we do apply a formula oftentimes for individuals that don't have a lot of money. What happens is they get an insurance, it's really a catastrophic insurance, and so unless you get hit by a bus and end up in the hospital, you're never going to meet the deductible. It's basically you don't have health insurance for everyday things. So those individuals can also come and we apply a formula and try and get them into what we are able to provide as well. So we don't provide services to children. That may be down the road at some point, but right now that's not where we're at. So to give you just a little background on our organization, back in 1997, a homeless shelter here in Pontiac had sent out hundreds of letters requesting physicians come and volunteer at their center to take care of the guests that they were hosting overnight. The only person who responded was Dr. Gary Bernstein. And so he started to do that at that time until 2003 when he became semi-retired, and he thought, well, I'm going to apply for a 501c3 designation, start a free clinic. And within a year's time, he did get all of the paperwork in place, but then he became ill and passed away. And then the Kensington Community Church approached his widow and his 2 adult children and asked if she would continue to move forward with his vision, at which they said yes, they would. And so the Kensington Community Church was very helpful to them, and they refurbished an old building in the Loop, and it was a 2,000 square foot building, and then the Gary Bernstein Clinic was born. And at that time, it was just for people who were at the shelter, and as time passed, it was for everyone here in Oakland County, or no, Pontiac initially, because other individuals in Pontiac needed services. And then after that, as they continued to grow, in 2013 actually, we received money to purchase the old Michigan ball bearing factory on Woodward Avenue. It was abandoned at that point. and more money was raised. It was completely remodeled, and so now that's where we are, right on Woodward Avenue, just south of McLaren Hospital and north of St. Joe's. And so we have a 7,000 square foot facility, and we provide what I consider wraparound services. And what I mean by that is that you come in for your basic medical care, but if you, in the course of having your physical, realize that you need a heart specialist, we have a heart specialist that's going to see you at your next visit. If you need a podiatrist, a gynecologist, ear, nose, and throat, rheumatologist, we have 15 specialties under our roof. So we're able to not have to refer those individuals out, because then you're kind of in the same situation you were before. Most specialists are not going to see you for free. But we have those people under our roof, those physicians. And we have 150 professionals who are completely volunteers. We wouldn't be able to do the work that we do without that. And there's 10 paid staff. So all of our resources really are a result of people that are working from their heart. Many of them are retired, but they like being out of that system, and now they can spend as much time as they want with the patient. I don't know if any of you have had this experience, but I know when I go to my own doctor, you know, she's like, okay, let's get through your questions, because she's got to move on to the next room. So we have, in addition to the medical side of it, we have a full dental wing where we can do everything that any dental office does. So anywhere from x-rays to cleanings to extractions to full dentures, partial dentures, fillings. That's really important to your physical health, as well as if you don't have teeth and you are trying to get out in the community to get a job, you're going to have a real rough time with that. So your self-preservation, presentation, your just sense of feeling good about yourself is wrapped up in that, and so is your health, because then you're not going to be able to eat well, and there's other issues that happen when you have gum disease and so forth. So we're able to do that. We do our own lab, and we send it out, but we draw at our clinics. So again, the patient doesn't have to leave the facility for anything. We're able to do eye exams and also provide eyeglasses. So that's another really important thing I'm really excited about, because we just got that about 6 months ago, ability to do that. We have a special veteran program on the dental side. We are partnering with the University of Michigan. So anyone who's a veteran and needs dental care, because I thought that was just something you would get as a veteran, and I found out that there's a lot of things veterans don't get in terms of health insurance and coverage. So that's something that we are also doing, especially for that population. We have a full pharmacy on site. The only thing we do not have is opioids. But if you have asthma, high blood pressure, diabetes, we're not just going to give you the diabetic medication that you need. You're going to get the meter, you're going to get the alcohol swabs, you're going to get the little lances so that you can, manage your condition at all times. So really, everything that a person needs, they're going to get. And part of our newest program is our mental health program. And I know that that's something that the county has been very invested in. We're still very small and growing. And we are, at this point, making that available to our patients who have had that need throughout COVID, but have not been able to address it. So that's the population that we're focusing on now, but we would like to expand that out to the entire community. We have also a vaccination program, so when a patient comes in, if they need their Tdap, their shingles, their flu shots, we have that available. And then we also have a COVID vaccination program, and that program will go out to any group in the community, whether it be a church, a Rotary Club, someone in their own business who would like to have us come out and do vaccinations and boosters. We can go out there, and we also partner with Fern Care and head out to his clinic and do vaccinations for his patients as well. So I gave you our reports, that you also have some idea of the demographics and where our funding comes from. And if anybody has any questions now or after Dan's done, I'm pleased to, yes.
What's the application or registration process to schedule an appointment?
Yeah, thank you for that question. So on the back of the brochures, there's a QR code. People can download that. You can do that from your computer, and then you can print out the application. You can stop in and get the application. You can fill it out online, but you still need to print it out. And I know that many of our partner organizations will help with that process when it's needed. So we are income qualified, and we are at 250% of the poverty guidelines. So you could be about $34,000 for a one-person household. But if you add another $11,800 for each individual member in your household, so if you have a family of 4, you could be at around $69,000 and still be eligible for all of our services.
Thank you.
You're welcome.
Commissioner Hoffman?
I just want to say thank you very much for all you do for the community.
You're welcome.
Greatly appreciated.
It's our pleasure. As I said, everyone there really is working from the heart. It's not because people are
Thank you.
interested in, for their normal cause.
Commissioner Powell?
And I have this amazing clinic in my district.
Yes, you-
So I do want to share with my colleagues, yes, their work is proven. And actually, I see a couple faces on here that I know, people that y'all have given services to. So even when you guys started, I actually visited you all more often when I was working for State Rep Tim Grimel still. But I've always had you all in my Rolodex, and I do share your information. And thank you so much. City of Pontiac truly appreciates you all, so thank you.
Thank
And
you
they are
very
good
much.
clinics, so refer people, please refer.
Yeah, if anybody's interested in coming on a tour, I would love to have you go through because it dispels that notion of a free clinic being some kind of little hole in the wall, subpar health.
No.
It's not, it's 7,000 square feet, it's state-of-the-art equipment and just wonderful staff that will uplift you. You don't feel like you're getting a handout or that you have to be ashamed that you don't have insurance because it isn't a person's personal fault that they don't have it. So we have very dignified, respectful services that we provide and a very positive, uplifting staff.
Yes, you do.
Thank you.
All right, and I don't know if you introduced yourself initially.
Oh.
So Susanna Jaskowitz.
Yeah, Susanna Jaskowitz. I say my,
Thank you.
when it looks one way, it's pronounced another, yeah. Thank you.
And you're the director.
I am the Community Outreach Director.
Community
Right.
Outreach. Thank you.
Dr. Justin Brox is our CEO, and he is always spread very thin. So
Yes.
he does a lot, including changing floors and creating new operatories when needed. I mean, he rolls up his sleeves and he just gets right in there and works alongside other people, so.
Thank you.
You're welcome.
Thank you. And so our next, oh, okay. So we need a motion, I have a motion by Commissioner Nelson to receive and file, and support from Commissioner Powell. All in favor, say aye.
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 Opposed? All right, so we have the information on file. Thank you. And in a similar vein, we have Dan Martin here from Fern Care Free Clinic to tell us about your services.
Sure. So thank you for having me as well. Fern Care Free Clinic is a community-founded medical clinic located in Ferndale, but to be honest with you, less than 5% of our patients come from Ferndale. We pull, and there's a slide in here that you've got in front of you, pretty heavily from Oakland, Macomb, and Wayne counties collectively. So we were started by a group of citizen advocates who were sitting around one day saying, what are we going to do about healthcare? And got involved in a social activist group called Citizens for Fair Ferndale, who helped do the founding 501(c) organizations. And we've been seeing patients since 2008. We've been in 3 locations. The first location, it's kind of a neat story, is the community center in Ferndale. They would come every Saturday and bring all of their equipment and the prescriptions and the medical stuff and unload and have clinic on Saturdays. And then at the conclusion of it, they'd load it all back up and then store it all off-site until the next Saturday clinic. And from there, they moved into a brick and mortar facility, which ended up getting redeveloped. So now we're at the corner of Hilton and East 9 Mile in that strip mall there, right at the corner. So we are small but mighty. We currently have 4 part-time employees and 79 volunteers. Much like Bernstein, all of our doctors, physicians, pharmacists, mid-levels, nurses are all volunteers. Our mission statement is on the second slide there, but it's really about in building community. The heart of Fern Care is to make people feel welcome. We see every day folks that have been turned away from the healthcare system and get treated honestly like second-class citizens because they don't have insurance. And they don't know what to do. And they don't know how to navigate the healthcare system. And they don't know where to go. So we're part of that social safety net, like the Bernstein Clinic, to help people kind of attach in and find those services and get care. So what we offer is we'd offer primary care. We do generic and over-the-counter medications. We do have a pharmacy in our clinic, as well as lab testing. We can process some labs in-house, and some we do send off-site. We started during COVID. We had to get innovative because it was COVID. So we started case management, and we started to see more patients with chronic conditions around diabetes and hypertension. So we very much see our role as walking with these patients through those diseases. So we offer medical equipment as well, glucometers, and we work with manufacturers of insulin to help people get insulin for free through patient assistance programs. But we also have nurses call them several times a month to see what their sugars are. Are they taking their sugar? Do they understand the need for tracking, to offer dietary assistance, nutritional counseling as well? So we're in touch with them several times a month to help coach them through those conditions, and we do that for hypertensives as well. And we've been doing that for about a year now, and have seen some really pretty promising results from it. We do a lot of counseling and referrals. We take a lot of calls a year connecting people to housing resources, transportation resources, just helping them fill in the gap. We do telehealth, and we just started offering physical therapy as well for patients. We don't have a gym set up, but they give them at-home exercises. They meet with them individually, set them on a path where we can provide equipment. We will. And I should add, we do all of this at absolute no cost to our patients. We only have 2 criteria to be seen at FernCare. That is that you're over the age of 19 and that you don't have insurance. We don't income qualify anybody. We don't ask any other questions except for research and social determinant information, for example. But we don't, those are the only requirements you need to be seen at FernCare. And how we accomplish this is not only through funding through grants and donations, and like I said, we're very community-based, so we still have a rummage sale every year that gets the word out and helps raise money and lets people connect. But we value our community partnerships so much. We work with World Medical Relief. We take in durable medical equipment, walkers, wheelchairs, canes, and we'll help get them to our patients, but whatever's not being used, we send to World Medical Relief and other agencies as well. We partner with the police department on things like drug takebacks and emergency services like community emergency response. We donate to the Detroit Diaper Bank, as well as offering mental health care through Southfield Mental Health Associates. If we refer the patients, they do the counseling for our patients at no cost, or maybe $10 a visit, something very, very minimal. And we love our other community safety net clinics. Bernstein comes in a couple times a month and offers COVID vaccinations. And we're really grateful for that because candidly, we don't have the space to store COVID vaccinations. And we also work with Corktown Health. We just have done a series of clinics for monkeypox vaccinations, as well as a few other things, which Oakland County participated in that as well. We do flu shots, of course, and we can store those inside. So we also do an amount of insurance counseling. If somebody says, I need insurance, but I don't know if I qualify, we have a group of volunteers that sits down, and we've last year have helped over 200 people find insurance on the exchange or through Medicaid as well, and those are all volunteers. And then other support safety net services as well. If we get a call, I always say our office managers will dig in and help them find. We don't say, no one leaves our clinic with nothing. We'll help them with whatever they need and have that flexibility to do that. I did include a slide on what the demographics look like. It surprises some folks that the far majority of our patients are employed, but they're either employed part-time or not making enough to afford an exchange plan. They make too much for Medicaid. They make enough to get an exchange plan, but can't afford the $4,000 deductible, for example, or can't even afford it on the exchange market as well. But most of our folks are working. And like I said, 46% comes out of Oakland, 30% Wayne, and 22% in Macomb counties. And some other stats that are just interesting, when it comes to social referrals to other agencies, we take about 3,000 calls a year. And to be honest with you, most of those is an 82-year-old lady, God bless her, sitting in the front office that's there every day, taking calls and helping direct folks. She just got a Senior Citizen of the Year for Ferndale. Honestly, they're going to honor her this week at a community event. She's awesome. And 1,300 walk-in inquiries, just because we're open and people know that we're there. We do over 3,000 prescriptions. I mentioned finding folks insurance. We do over 1,000 lab tests. And the other thing, we really volunteer or value our volunteers, obviously. We couldn't do what we do And one of the first things we tell folks at orientation is take as much time with the patients as you want. This is not a time test. We book so our doctors and our nurses can go and practice medicine, why they got into practicing medicine, to spend time with the patient. And for all of the care, we spend about 28 minutes per patient between the nurses and the counselors and the doctors as well. So a really robust experience. And all that equates into over 3,000 volunteer hours, which I think is absolutely incredible. And then the last page are our organizations, again, that we belong to. Our partnerships are critical. Besides the local chambers that we get a lot of resources and connections with, we do belong to the National Association of Free Clinics and the Free Clinics of Michigan. In fact, our founder and former executive director is president of FCOM right now. And I know Bernstein's very involved in those organizations as well. But we value, again, those relationships very much. So all that's great. The volunteering's super important. The building of community is really heartwarming, but there's economic value in what we do as well. We know for the primary care experience, there's a 2.5 to 1 ROI for the patients that come in than what the healthcare system would experience had they gone for services as an uninsured patient as well. We know that we are deferring $1,060,000 in emergency room care a year by having the patient volume that we do and the care that we do. There's on the pharmacy side alone, there's $572,000 a year in healthcare savings going through the donated medications that we use and then the medications we get at rate had the patients had to go and pay out of pocket without insurance. But let's be completely honest, they probably would go without in many cases. So it's not only good work for the community and to keep our community healthier, there is a real ROI on this investment for these free clinics that are helping bring people into better health care, where they would either get substandard or pay an enormous amount of money and rack up debt or just not get care at all. And so these are amazing alternatives for these patients. And our volunteers, I have to say, much like Bernstein, are really, it's heartwarming work. They love the experience. And we take safety incredibly seriously. The volunteer clinical staff told us many times that they feel safer at Fern Care than they do at their day jobs at the hospital or in offices, because we were so fastidious about our care and our safety during COVID. And I would be remiss without thanking all of you for helping keeping us going during COVID. The financial assistance early on that the County Commission offered, that we applied for and benefited from, was a godsend to us during that time. We didn't know what we were going to do, and it saved us from, I'm not one to panic, but delving into panic a little bit, So my heartfelt thanks for that support during COVID as well. It was incredibly important.
Thank you.
So questions, anything I can answer?
How would someone make an appointment?
You just give us a call, and we have staff during the week between 9 a.m. and 2 p.m., or you can go online and make an appointment online if you'd like. We do use electronic medical records, and we do have a patient portal, so people can get their lab results online, they can make appointments online, and then we try to reach out to patients before their first visit to get as much as the registration done, so they're not tied up in waiting rooms and stuff while we're waiting. But sometimes we don't connect and we just do it while they're there at the first visit. But right now we're booked out about 6 weeks, but that fluctuates based on the time of year and what we're offering. We do offer other specialty clinics. For example, we open twice a month just to do HIV STD testing, and we partner with Matrix Human Services to do that. And some of those specialty clinics are walk-ins, so there's no appointment needed. But you just give us a call.
All right, thank you.
Sure.
Thank you, Commissioner Cavell.
Yeah, I appreciate you lifting up all these services that you offer. What are some gaps that you find in your work? What do
Yeah,
you need more of?
dental, and that's where we rely on our partner clinics, so we don't have the space or capacity to do dental or vision right now. We do have a specialty network we refer to. In our volunteer base, we do have a cardiologist that sees patients. We do have some specialties covered, but we refer on fellow clinics or other people we have arrangements for a referral clinic. And I think the volunteer base, is starting to come back more from COVID. We keep to 6 primary care clinic sessions a month, but we want to get to 8. And I think that's largely dependent on being able to garner Not as much the registration folks, but really the MDs and DOs, and some of whom are starting to come back now. They're feeling more comfortable. They're retired and didn't want to do it during COVID. But so I suspect within the next 12 months, we'll be back to 8, or not back, we've never had that many. We'll be at 8 primary care clinics a month.
Okay. Is that the same for you all, dental?
Well,
and-
I think for us, it's really volunteers, because we could expand our services further if we had more volunteers. So that's something that is continuously being worked on. And right now, we're really looking to find a nutritionist, because we did have one and we lost that person through COVID. And that's a really important part of the work we do. So many of the people that we have are diabetics, and that was very central to kind of social determinants of health and getting everybody on board, not just with your health on one level, but to cover all of it across all areas. And so that's I think our challenge right now is more volunteers, so that we can provide the services that we need to be able to provide, because our numbers have been increasing. So that's where we're at right now, but we're working hard to make sure that happens. And I would love to see, because we do have a very small social group, and we're focusing on social determinants of health, I would love to see us have more support in that area. And I know that our fund developer, which we've had now for about a year, is working on that as well. So I think those are hurdles that we'll be able to jump. It's just a matter of time. Yeah. Oh, and I wanted everybody to know, we're part of the Oakland County 360 initiative from the executive's office. And so right now, there's only 4 organizations, and we're still, the leader agency is the health department, and there's a system in place so that we're not only just making referrals to services that we don't have that people need, but that we're going to get a feedback loop. So you're not just giving somebody a number and saying, good luck, that we actually, that person at the other end gets the referral and says, we got it, this is what we did with it, and now we know that the person's received the service, the full spectrum of services that they required.
And you talk about growth, I can jump in. Through COVID, we were running between 18 to 20% more patients a year, just since COVID started. So there's definitely still a need.
Yep, thank you. So for the Gary Bernstein Clinic, is there, if I am making an appointment
Yes.
here, how long would the wait be?
For the medical side, it's
Yes.
4 to 6 weeks out right now. It used to be like within 2 days. So our numbers have increased dramatically. And for dental, unless it's an emergency, it's gonna be about 4 to 6 weeks as well.
Okay, thank you.
You're welcome.
Any other questions or comments? All right, thank you both for
Thank you so
being
much.
here.
Thank you for having
Thank
us,
you.
appreciate
Yeah.
it.
We're proud to live in Oakland County because of what you do.
Oh, thank you.
Thank you.
Thank you. So I need a motion to receive and file the information. I have a motion by Commissioner Hoffman, support from Commissioner Cavell. All in favor say aye.
Aye.
Opposed? All right. That motion is carried. We move on to our regular agenda. The first item is from the Prosecuting Attorney's Office. It's a grant acceptance from the Department of Health and Human Services for the fiscal year 2023 Victim Rights Grant. I have a motion by Commissioner McGilvery, support from Commissioner Nelson, and we have Mary Larkin here to address this item. Welcome.
Good morning. I am Mary Larkin. I'm the Victim Services Leader in the Prosecutor's Office. And this grant provides reimbursement for 7 full-time positions in our Victim Services Division. That includes 5 victim advocates, my position as victim leader and victim advocate leader, and then also 1 full-time office clerk. So these positions satisfy the requirement that we are mandated by the Crime Victim Rights Act to provide victims who request notification about the status of their case. We also provide personal advocacy, where our advocates accompany victims to court for emotional support, and they provide referrals for services for them. I'm happy to answer any questions that you may have. This is the 31st year of this grant, and so we're really pleased to be able to continue with these services. They're not only are they mandated by law, but they're absolutely critical to keeping victims informed and involved in the case as it's going forward. Thank you.
Thank you. I'm impressed that you would also attend court hearings. That
We
certainly
do.
is a great support.
We assign victim advocates to accompany victims in person, especially on cases that are more complicated and more emotionally charged, such as sexual assault cases, cases involving child witnesses, any case that results in the death of a victim. We specially assign a victim advocate to accompany those family members, so they're fully aware of the legal proceedings, and we help out in many ways. We also are happy to have our 3 canine advocates you may be aware of. Those are dogs that are in our office, and they are owned and handled by victim advocates themselves. So they're available every day to go to court with child witnesses, and they have proven invaluable in court cases.
Thank you. I did not know that. All right, and Commissioner Cavell?
I see in the resolution that there was like a reduction in funding. So there's one staff position that will no longer be reimbursed through the grant?
That's correct. With the increase in, I think it was the 5% cost of living increase, the grant award that we were provided didn't cover all of the positions that it had in the past. And so our general fund will be providing funding for that position. So it will still be maintained.
Okay, gotcha. Thank you.
You're welcome.
Any other questions? All right, the vote, please.
You have 6 yeas, 0 nays.
Motion carries. Thank you. So don't go
Thank
away,
you.
Mary.
Okay.
You also have the next item from the
I do, yes.
It's a grant acceptance from the Michigan Department of Health and Human Services for the fiscal year 2022 Anti-Terrorism Emergency Assistance. So I have a
Yes.
motion. Oh, hold on one second. I need a
Excuse me.
motion by Commissioner Cavell and support from Commissioner Nelson. All right, now we're ready. Thank you.
Thank you. This also is a reimbursement grant. It is in connection with the Oxford High School mass shooting case that occurred November 30th of 2021. That involved the death of 4 students, 7 students and 1 faculty member physically injured by gunshot wounds. And there are approximately 1,800 terrorism victims in that case. And they are the student body who were enrolled on that date of November 30th, 2021, as well as the staff and faculty members. So this grant has provided funding for 1 victim advocate full-time and 1 full-time office clerk position. And that allows us to be able to provide the services that we need for this extra volume. We have been busy on that case, as you can well imagine. It's involving 2 separate cases, one against the Oxford High School shooter himself, and then also his parents are charged separately in a court case with involuntary manslaughter. So this grant allows us to keep all of these victims updated on the status of the case. We've had tremendous help from our county information technology department, developing an email blast system where as soon as a hearing is held, we are updating victims electronically by email immediately. So it's been invaluable. So we greatly appreciate this opportunity.
Thank you. Any questions?
Thank you.
All right, prompt the vote, please.
You have 7 yeas, 0 nays.
Motion carries. Thank you. Thanks for
Thank you
your
very
work.
much.
All right, our next item is from the Sheriff's Office, a grant acceptance from the Michigan State Police for the fiscal year 2023 Oakland County Narcotics Enforcement Team Burn Grant Program. I have a motion by Commissioner Hoffman, support from Commissioner Powell. And we have our undersheriff and Gaia Peer to address this item.
Good morning.
Morning.
So this is our annual narcotics grant. It's a joint effort between the sheriff's office and the prosecuting attorney's office. The total program amount is $521,648. It continues 4 positions, 2 full-time sergeants in the sheriff's office and 1 part-time non-eligible office support clerk, and then 1 full-time principal attorney in the prosecuting attorney's office.
Thank you. Any questions regarding this item? Prompt the vote, please.
Keeps leaving me.
Okay.
Sad.
Hoffman?
Yes.
We have 7 yeas, 0 nays.
Motion carries. Thank you. So you'll be with us for the
Yes.
next 7 items.
Yes,
The
we-
next
we're
item
here
is
for
a
the long
grant
haul.
acceptance from the Michigan Department of State Police for the fiscal year 2023 Secondary Road Patrol and Traffic Accident Prevention Program. So I have a motion by Commissioner Hoffman, support from Commissioner McGilvery.
Okay, so this one, we have really good news. This is our annual secondary road patrol acceptance, and we're getting almost $1.2 million. I want to thank the board staff. This is the one where our initial allocation wasn't enough to continue all of our positions, so we were going to have to delete positions, but then the state came through with a legislative change. So hopefully this grant is fixed permanently going forward, and we will have enough money to continue this. We won't have to do the delete and create roller coaster that we've been on the last several years. So this actually continues 7 positions, a full-time sergeant and 6 deputies, and then creates an additional deputy. It also allows for vehicle expense and some equipment purchases.
Thank you.
So, but anyway, so the board staff, we got the additional allocation in between. We submitted the original award and then have scrambled in the last week or so to get it, so we didn't have to delete the positions, that we could keep moving forward. So the board staff was really instrumental in helping with that, so we appreciate that.
I'm glad it worked out.
Me too.
Any questions? Prompt the vote, please.
Seven yeas, 0 nays.
Motion carries. Thank you. Our next item is a grant acceptance from the Department of Justice for the fiscal year 2022 Bulletproof Vest Partnership Program. I have a motion by Commissioner Hoffman, support from Commissioner Powell.
Okay, this is our annual Bulletproof Vest grant. So we're getting a little under $23,000 this year, which will supply almost 45 vests. Our vests cost $505 each, and we're on a 5-year replacement schedule. We applied for a little over $111,000, and then it resulted in this award. This one has been up and down over the years. We've gotten as little as 0. One year we got about $134, so $22,000 is a pretty good award in our eyes.
Thank you. Comments? All right, prompt the vote, please.
You have 7 yeas, 0 nays.
Motion carries. Our next item is a grant acceptance from the Department of Justice for fiscal year 2022 DNA Capacity Enhancement and Backlog Reduction Program. So I have a motion by Commissioner McGilvery, support from Commissioner Powell. Thank you. We're ready.
Okay, so this is our annual CBER grant acceptance. We're getting a little over $500,000 to continue 3 forensic lab analyst positions to continue working on our DNA backlog.
Thank you. Any comments? Commissioner McGilvery?
Question, how is the backlog?
As of, hold on one second. In biology, we're backlogged about 362 cases at this point. I think our high backlog was about 464 cases. That was back in November of 2021. So even though we've had an overall increase in staffing over the past 3 years, the DNA test requests have almost doubled. So I think they're making progress, but I think the motto since we started this has been, if you build it, they will come, and they're here. So,
And AM.
yes.
Thank you. Prompt the vote, please.
You have 7 yeas, 0 nays.
Motion carries. Next item is an interlocal agreement with the Chartered Township of Brandon, an amendment number 1 to the 2022-24 Law Enforcement Services Agreement. I have a motion by Commissioner Hoffman, support from Commissioner McGilvery.
Okay, Brandon Township has requested to add one new Deputy 2 position effective January 1st of 2023.
Commissioner Cabell?
Yeah, I have a couple questions. So, in the Schedule A, it says that this will be $109,000 for a new deputy with the phone in the car. But don't we generally, when we make a new, just from having worked together, making a new position like this, isn't it like $130,000?
Well, this is a new, are we adding a patrol investigator?
There is one that has a patrol, I think that's
Okay.
Rochester.
Yeah, so the
Hills.
patrol investigator comes with, actually, this one is not, I'm sorry, the other one has
Yeah,
a
that's
patrol
a different
investigator.
one.
This one is a deputy 2, but we're adding a vehicle because what we do with the regular deputies is a formula. So for every 3, usually, so every 3 share a car. And so when you get to a certain number, when you go over that number, then you have to add a new car. So-
Okay, but
But this is the deputy 2 rate, so the deputy 2 no-fill
okay,
is what you're looking at?
the 109, but I thought we've done it before where it's like 130.
I would have to pull up the rates, but 109's low. I'll have to tell, because we have a whole chart that you guys approved back last December, so it's based on that rate. So it would be the 2023 rate for a deputy 2.
Okay,
I can send it to you, and I'll send it to you in an email.
Yeah,
I don't have it
thank you.
handy, but I'll send it to you. I have the snip.
and then the second question is,
Mhm.
again with the Schedule A, it becomes 150 a year, starting next year. What's the $40,000 jump? for?
So I'm not sure, because I'm looking, well, deputy 2, right now, we have 10 of them, so I don't know what Schedule A, I guess for Brandon, I'm looking,
Yeah,
because they have 10 deputy 2, so it's calculated out, their annual costs for 2023 are almost 1.5 million, so I'm not quite sure which one you're,
so I'm looking on, I guess maybe it's our board thing, so it says that 2023, the amendment, so the new person will cost 109,000, which that's my question with the 109 versus 130, because I'm wondering if the
Okay.
fee that they pay is lower for some reason.
okay, I don't have that in this document, so I'll have to see what you're looking at, but I can give you
Okay.
exactly what.
Yeah, I don't know how to make it in real life, but we'll figure it out.
Okay. Is it on this,
It should be in the civic clerk.
because the Schedule A is what's included in the agreement. So this is Schedule A of the law enforcement agreements that have the number of positions and then the calculation.
I'm talking about our Schedule A that we have from the executive office that talks about the budget amendment. Maybe there's someone from staff who can help. Just because there seems to be a $20,000 discrepancy and then a $40,000 discrepancy of what I thought the formula is. So, we can figure that out offline.
Okay, I was gonna say, I'll get back, because obviously this is actually, so this is the budget amendment,
Mhm.
which is broken out differently, because if you see, part of it's in the general fund, part of it's in radio communications, part of it's in Clemis, then there's IT
Yeah.
and motor pool.
Yeah,
So that 109 is just the portion that's in the general fund.
And
And then the
the
rest
line
is-
item you're looking at is sheriff's special deputies. Is that what we're talking about?
So
Yeah.
that's the revenue line item in the general fund, but
Mhm.
then there's, all these other transfers need to happen to get the radio,
Add up
to
to
get
the
the body
109,
worn
yeah.
camera, to get the vehicle, to get all of that, so.
so then is the total cost 109 or
But the
something different?
but the contracted rate is what we bill them.
Right.
So, we can figure this, I can send you an email offline, that's,
Because
I have it.
because based on the
Mhm.
contracted
The
rate
crazy
then,
thing
Right.
it's
because of
109.
the success in the
No.
papers.
No.
The contracted rate is higher, this is just the breakdown of what's the salaries and fringes that are going in the general fund for that position. But I'll give you the comparison. I'll send it to you.
Thank you. And then, since we're looking at the same thing, what then is the reason for the jump of $40,000 for the salary related?
Because
Is that what?
it's
that's-
prorated, because we're in fiscal year, our fiscal year starts October 1st of 2022. So that 23 amendment is only for 9 months from January, starting in
Okay.
January.
Why it's 109
Yes.
instead of 150? Understood.
'Cause-
Okay, thank you.
Because we're dealing with fiscal year versus calendar year for that
Yeah.
part of the amendment.
Yeah. Thank you, that's all.
Sure.
All right. Prompt the vote, please.
We have 7 yeas, 0 nays.
All right, motion carries. Our next item is another agreement with the City of Rochester Hills, Amendment 1 to the 2022-2024 Law Enforcement Service Agreement. I have a motion by Commissioner McGilvery, support from Commissioner Nelson.
Okay, this is for the City of Rochester Hills. They are requesting to add 3 more positions to their agreement, 1 sergeant and 2 deputies.
Any comments? All right, prompt the vote, please.
We have 7 yeas, 0 nays.
Motion carries. The next item is another agreement with the Charter Township of Springfield, Amendment 1 to the 2022-24 Law Enforcement Services Agreement. I have a motion by Commissioner Hoffman, support from Commissioner Nelson.
Okay, this is the Township of Springfield, and they are requesting to create a lieutenant position, and then they're also deleting a patrol investigator position.
Commissioner Hoffman.
I have a question. The township is requesting that they want another lieutenant.
They don't have one as of, right now, they don't have one. They have a detective sergeant as the substation commander, and so they're adding a lieutenant.
Oh, until they add a lieutenant,
Yes.
okay, I didn't know what the
Yeah, so they don't have one
thought
currently.
was
Yep.
on that.
Yep.
Okay, and the one in Rochester we just did where they added 1 sergeant and 2 deputies. How does that determine? Is that because of the chain of command and there's so many deputies, you need a sergeant, or how's that determined?
I think the sergeant, this position is the SRO position from, so this sergeant's position is specifically for the school resource officers. They have 4 there now, plus 2 from Rochester City that we have deputized to be in our schools. So we do kind of, between us and the city, there's a ratio we use for supervision. It's
Okay.
around 6 to 1. So
Okay, that's
probably-
what I was curious about. Okay, thank you.
You're welcome.
All right, prompt the vote, please.
You have 7 yeas, 0 nays.
Motion carries. Our next item is an interlocal agreement with the Somerset Collection for 2022 law enforcement services. I have a motion by Commissioner Nelson, support from Commissioner Powell.
Okay, so this is I think our 3rd year, so an annual agreement with Somerset where they've asked us to provide mounted deputy and deputy services throughout the holiday season. So we have agreed to do this as staff is available, and we'll charge them our overtime, our contracted overtime rates.
And it is a well-needed effort, and people do comment on the mounted sheriffs throughout the parking lot. So it does deter crime. Commissioner Powell?
When you say mounted, what is that, our horses or
Horses,
something?
yes. Mhm.
And they be out there in the winter like that?
Well, we have a clause in here that
That's
says,
funny.
based on, based on the weather, if it's severe weather conditions, so safety for the horses and the deputies, it's based on their availability and then the weather. So if it's a day like today, then it would be fine. If it's
Oh, okay.
really icy,
So
then
if-
probably not.
So days that it's bad, our sheriffs will be inside, right? And
Yeah,
they'll
we
just
wouldn't
be-
have the horses there on those days where
Oh.
it's, if the weather's really dangerous.
Okay, so what is the significance behind the mounted ones? Like, why did they request those? Is it because of the appearance for outside for deterring crime?
I think so, just
Oh,
to
that's
have
what it
the
is?
presence, yeah. yeah.
Oh, okay.
And it does work, because a lot of crime happens at the cars. It's not just shoplifting from inside.
Oh, you
So
know what? I ain't
a
think of
lot-
the cars. I ain't think of the
People may
cars.
follow them to their vehicles, and having the mounted staff out there is amazing.
Okay, great. Thank you. Learn something new every day. All right. Okay.
Commissioner Cavell?
Am I reading this right? Are the mounted deputies' overtime rate is like $40 an hour, but everyone else is like $75 to $100 an hour? Why is there that difference, if I'm reading it right?
The horse
Mounted
is
deputies are
free.
part-time.
Yeah.
Sure. Huh?
Mounted deputies are part-time positions and
Okay.
not full-time positions.
Gotcha. Okay. So what, but still, like, they're working, whether they work 8 hours or 4 hours, they're still working those hours they work. They just get paid less for it?
Well, they get paid a part-time Court Park deputy salary. So this is what we charge the community. This is the contracted rate we charge the community, but not necessarily what the deputy is getting paid per hour. They get paid the rate that
Okay.
their actual salary rate.
So then, do they get paid more than that? And the, what's it called, the mall only absorbs part of the cost?
No, they
Or
don't
only
get,
gives us
they
part
don't,
of the
yeah, no, the mall pays the contracted rate. The contracted rate has everything from salary, fringes, vehicles,
Yeah.
maintenance, all of that stuff is built in. So the rate that the mall is paying is higher than the actual hourly rate that the deputy is getting paid because we're trying to recoup all of our costs.
Gotcha. Okay, thank you.
Commissioner McGilvery?
Yeah, do you have any kind of statistics that shows that having them present has reduced the crime rate?
I don't know that we do. I was gonna say, I don't know that we actually,
Hard to prove a negative.
yeah, hard to prove what we.
What didn't happen.
Yeah, we would like to think that the presence helped. Obviously, the mall thinks that the presence helps and they're willing to pay. But I don't know that we have any hard stats that say what level of crime we've avoided.
Are the deputies that are on the horses, they're part-time, but can they be used elsewhere, part-time, other than on a mounted horse? In other words, I'm asking, are we taking away from our workforce to supplement, the shopping mall?
No, not for this. The mounted division, mounted deputies are specifically for special details. We don't pull them from other areas to work mounted. They really only work the mounted details.
All right, thanks.
All right, prompt the vote, please.
We have 7 yeas, 0 nays.
Motion carries.
Thank you.
Thank you for staying with us. It was a great financial
Lots going on.
meeting so far. All right, our next item is from Emergency Management and Homeland Security, the grant acceptance from the Federal Emergency Management Agency for the fiscal year 2021 Building Resilient Infrastructure and Communities Grant Program. We have a motion by Commissioner Nelson, support from Commissioner Hoffman, and we have Tom Hardesty to speak to this.
Good morning, Commissioners. We appreciate your time today. If you'll recall, last year the board approved a feasibility study for a sheriff's training center, a storage facility, and a combined EOC 911 center. So at that time, we had discussed seeking whatever grants might be available. So our office applied for a Building Resilient Infrastructures grant, which would support the EOC 911 center. The recommendations from FEMA and architects would be that it would be a hardened facility, meaning it could withstand weather. So with this grant, we applied to FEMA, and they would pay a portion of this feasibility study, which the first part of the feasibility study is a pre-design and schematic design. So that portion that relates to the hardening costs for this pre-design and schematic design, and then if this project moved forward into other phases, again, for those pieces related to the hardening, they would pay up to, for this whole project, $435,000. So for example, for this first piece that the board has already approved, the cost that the architects have estimated for the hardening piece is $155,000, and we could seek reimbursement for 75% of that. And then nothing would, again, for those next phases, it would only be if they were approved by the board and those expenses were approved, and then we could seek reimbursement in pieces. The important part for this is, one, we have 3 years that we can expend these funds, so there is time to move through this. And this is a good indicator. They never guarantee anything, but if we did ever move forward with a building, the next phase would be applying to have that actually hardening piece of the building to be paid for with grant funds. So it's a good sign if they've approved this kind of money for the design piece of that.
Thank you. Any comments? All right, prompt the vote, please.
I also just had a
You have
quick
7
clarif-
yeas, 0 nays. All right, motion carries, and Commissioner Cavell has one last comment.
Yeah, I was just gonna ask, so this would be the 911 hardened building,
This would only apply to the EOC 911
and so where would
center.
that be? Yeah, is that an existing building, or that's part of the schematics?
The part of this feasibility study would be proposing where. I have Matt McDougall, who's from the project manager on this from facilities, is here. So this is just, this piece
Yep.
is what the design to help give an estimate of what the costs would be, what the size of the building would be, and part of that determination would be, okay, what would be an appropriate place for that?
Okay, and this was already part of the conversation related to capital needs?
Yeah, so this is, so this, I guess, started maybe a little before that,
Yeah.
but is now woven into that capital needs study as
Okay.
well.
Great, thanks.
Thank you. Thanks for spending your time with us.
Thank you.
Our next item is from the Animal Shelter and Pet Adoption Center, staffing modification, positions, deletions, reduction, and creation. I have a motion by Commissioner Cavell, support from Commissioner McGilvery, and we have Bob Gatt here. Welcome.
Thank you. Good morning, Commissioners. Before I begin, I just want you to know that right now at the shelter, at least at 10:30 this morning, we had 140 dogs and 160 cats. It's busy, it's crowded, it's full. So I'm here this morning to request your approval to eliminate a few PTNE positions from our roster to create one full-time animal shelter attendant position. Now, those staff members are the people you see when the public first enters the shelter. Their duties include answering phones, waiting on customers, helping with adoptions and owner give-ups, scheduling visits, moving animals, cleaning when necessary, working with the medical staff, and a myriad of other tasks. Over the past several years, their workload has increased, necessitating the need for an additional full-time staff member. The moves being proposed are revenue neutral and have been reviewed and approved by both our financial analyst as well as our administration.
So the part-time positions that are being eliminated are not filled right
These
now,
are
so
these are
no
vacant
employees going to
vacant
be-
part-time positions, and they're not 1,000 hours as a normal part-time position is. They're just fractions of that. Some of them are 250 hours. I think a couple of them were a little bit more. I think there was one or maybe two out of the 7 that were 1,000 hours. But by eliminating these vacant spots and creating one full-time spot, it's going to go a long way toward making our operation more efficient.
Thank you. So, because there were 7 part-time positions and they have different hours, do the total of the part-time positions that are vacant, do they add up to more than one full-time person?
No, the ones that we have proposed to eliminate are almost exactly equal to one full-time position.
Thank you. Any other questions? All right, prompt the vote, please.
7 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is from Health and Human Services, the Health Division, a grant acceptance from the Michigan Public Health Institute for the 2023 COVID-19 Health Equity Regional Council Backbone Organization Grant. I have a motion by Commissioner Cavell, support from Commissioner Nelson, and we have Leanne Stafford here to talk about this item.
It's good afternoon. It's just turned good afternoon. I was going to say good morning. Nice to see everyone. Yes. So I also have Carrie Rabar with me here today, who is really overseeing this grant. So when we get to programmatic questions, if you have them, she's going to jump on and help too. So this grant that we have been awarded and hope to accept is really focused on creating a council of community members and community agencies to really focus on the disparities that were created due to COVID. And so this council that we are going to create, and the backbone, I even asked Carrie this morning, what does it really mean to be a backbone? And so really what we're here to facilitate the staffing and to try to get that council set up and support that. So due to that, we are looking to create one new position as part of this grant, a coordinator that will work with Carrie and her team and the community to create the council, keep it going. The funding amount is about it actually is $300,000. The funding period starts December of this year and runs through May of 2023. So we have our work cut out for us to really get moving with this. So if you have any questions, we're welcome to take that. And like I said, Carrie's here to help answer those questions.
So it sounds like this is the first phase, and the second phase or piece of it would be reviewing the recommendations from the committee. So
That's correct.
directions
Is that
to
correct?
be determined.
Yes.
Okay,
Yes.
thank you. And Commissioner Cavell?
Is the model of subawardees participating in the council, is that something that's part of the state program, or is that something we're doing that's unique?
They really wanted a bulk of the money to go out into the community and to community partners. So the other regional councils are kind of implementing it in different ways, but most of the agencies that were awarded this are doing some subawards, subcontracts, getting that money out into community and community partners.
Okay. How do we make sure that the folks that you're listing here, how do we make sure the people that are participating, or what have you put into place to make sure that it's kind of not just the executive director or something showing up for coffee hour meeting? So that the people actually part of the council that are getting the compensation are the ones on the ground are impacted?
Yeah, so the membership of the council is going to be comprised of some more like agency organizational staff, and we're going to be trying to develop some new partnerships there with maybe more like grassroots community level people. But then there are also going to be, we're required to have representation directly from community members, and then that they will be compensated for their time too. And we will use our partners to try to help identify community members that want to participate in this project.
Okay.
Commissioner Powell?
Because they're in the process of formulating this, and I do see a couple community groups that I am aware of, may I ask, Chair, that once they have everything established, can they come back to us to review what's the formulation of this group so that we can have a clear understanding of all the partners that's at the table with this organizational grant?
So you're looking for an update perhaps at
Yes.
the end of January?
Yeah, just when they get it. And I think that'll help my colleague Cavell to kind of get a clear understanding so we kind of know all the partners that's in this, just to make sure that all the groups that they have listed here, because, you know, we kind of big on this diversity thing and making sure we cover the grounds, and just, you know, just to have clear understanding and more transparency so we know the groups that's involved. Please.
Of course.
Thank you.
All right, anything else? Prompt the vote, please.
You have 6 yeas, 0 nays.
Motion carries. Thank you. Thanks for being with us this afternoon.
Cavell, put that on your list. I know you'll
Our
remember.
next item is from the 52nd Floor District Court in Troy. It's a grant acceptance from the State Court Administrative Office for the fiscal year 2023 Michigan Drug Court Grant Program. I have a motion by Commissioner Hoffman, support from Commissioner Cavell, and we have Patricia Bates here to talk about this item, perhaps.
Perhaps
Did all of our
not.
colors leave?
Let's see what we got here. Oh, here she is.
Oh, thank you. We had to split the screen. Glad you're here. Oh, and maybe we.
Oh, gone again. There I am. Oh,
There you go.
There you go. Yes, thank you.
good morning, or good afternoon.
Morning.
Afternoon.
So,
Afternoon.
yes, afternoon. What would you like to add about this?
We just made it. So I'm from the 52 Forum, the probation supervisor and district court coordinator for our program. And this is an acceptance grant for $120,000 to continue our drug court program.
Thank you. And I'm very pleased to see our specialty court programs, drug courts and our mental health court. So I'm glad we provide that service. Any other comments?
As are we.
All right, prompt the vote, please.
You have 6 yeas, 0 nays.
All right, motion carries. Thank you. You are good
Thank
to
you.
go.
Have a great day.
Thank you. Our next item is from the 52nd Third District Court in Rochester Hills, a grant acceptance from the State Administrative Office for the fiscal year 2023 Michigan Drug Court Grant Program. I have a motion by Commissioner Powell, support from Commissioner Cavell, and we have Amy Luce here regarding this item. Welcome.
Good afternoon, Commissioners. Thank you for taking the time to hear me this afternoon. I'm really just going to touch on a big difference that we have with our program this year. You'll notice that our award amount was significantly lower than it's been in the past. This year, we were awarded $13,123, and historically, we're usually around $90,000. The reason for that is that in March of 2022, our full-time grant-funded probation officer resigned to take a position as a social worker in a school district. So at that time, we really evaluated our program to see where we were at with our participant numbers and if it made sense to have another full-time grant-funded probation officer, because our numbers are typically smaller than the other programs. We average about 20 participants. One of the factors, the biggest factor in making this determination was consistency. We wanted to provide the participants and the team with the most consistent program they can get, which means that we have consistent probation officers. So I met with our judges that participate in the program, and we decided to go ahead and eliminate the grant-funded position and use 2 of our general fund probation officers to assist with the drug court treatment program. These 2 probation officers are outstanding. They have such a strong passion for the program. They just didn't want to give up their traditional caseload as well. So this not only benefited the program because now we have 2 probation officers who split the 20 participants, so it's very manageable. But they're very passionate about it. They're long-term employees. They're going to be around for a while. They're not going anywhere. So it's really provided a lot of consistency for the program, but it also allows them to do both aspects of the probation officer position, both that they love. It was kind of a win-win for everyone. And then we're also not in this position where we've been the last couple years where we don't get awarded enough funds to cover a full-time probation officer and fund the program the way we would like. So we're kind of stuck in this mid-year quandary. I know one year we got a grant match, which was wonderful, but we certainly aren't able to, nor should we, count on that every year. So this is a good way to stabilize our program. We are providing exactly the same services to the participants. Those services have not been cut whatsoever. It just really was the elimination of that full-time grant-funded probation officer that really wasn't necessary given the size of the program that we have.
Thank you. Is the lower number of participants due to the size of the city versus the number of people drinking in Rochester Hills?
No, I don't think it's that. We have historically had a smaller program. All of our files are, all of our defendants, when they come through the door, they're all vetted the same. We have a clerk that looks at each file that comes in. So the clerk has never seen this person, never met this person. It's very, very objective criteria. They flag the file if they're a possible candidate for our drug court program. And then it's given to the judge, and then the prosecutor can talk to the defense attorney about it as well. But what we have been noticing is that with this recent change in legislation that allows defendants to request a 50% reduction of their probation time, we've been finding that a lot of attorneys have been advising defendants to take that option because they theoretically could be done with probation in 6 months as opposed to a 2-year intensive program. So that is one thing that we've noticed. But again, our program has just historically been smaller, and it's voluntary for the participants. We never force anyone into the program. It's really up to them once they've been identified as a candidate.
Thank you. Commissioner Cavell?
How many active cases do the 2 remaining probation officers have between them? Not of just drug court people, but just in general, their caseload is how many?
On average, you want to include both the drug court program and non-drug court?
Yeah.
So their total on average is about 100 to 120.
So they have, and then you give each of them 10 more cases currently.
Well, that number included the drug court. So if you take away the drug court, they would be probably at about 100.
Okay. It does, I hear what you're saying about trying to stabilize when someone leaves, but that doesn't sound like an effective long-term plan because it just doesn't make sense why someone is having to do more work for the same pay and will then be expected to do that more work in an equally good way when you have a program that's intensive that requires a heavy investment from the participant and then also assumingly the probation officer, which is why there was an FTE there in the first place. So is there a longer term plan? Because I get this is a stabilizing thing, but what's the long-term plan?
Well, that actually is a reduced caseload, what they have. Our probation officers that only do traditional caseloads have about 150 to 160 defendants. So them having 100 to 120 is a reduced caseload because we do realize those 10 drug court cases do consume more time. So on average, if they're not doing any of the drug court cases, they're at about 150 to 160 defendants.
But what's your long-term plan? Because again, that doesn't sound sustainable.
But
this actually was our long-term plan. We do believe it is sustainable, again, because of the balance. We've, essentially lowered their caseload compared to the other probation officers to be able to allow them to devote that amount of time to both their drug court cases and their traditional cases. So if we were to take the drug court cases away, then their traditional caseloads would be bumped up again to 150 or 160.
Sure.
So it does average out where it's the same amount of work throughout the department. These two probation officers actually requested to be able to do this because, again, they are very passionate about the program. They just didn't want to do only those cases because they enjoy the traditional approach as well.
But it's, understood, but it sounds like then what I foresee from what this tells us and what you've been sharing is that there's 20 participants a year, which is already lower than other courts. And so then this disincentivizes judges and clerks and others to have more people participate in this service if they're in need of it or would benefit from it. So
I'm going to
foresee-
answer that, and I'm going to interrupt you because you're making assumptions based on your perception. That's
what I'm
not
asking.
reality.
That's
I was
what
a
I'm
probation
asking.
officer for a year, so I
Understood,
think this is
yeah.
very realistic to do.
But I'm saying this is a unique situation, and so I'm asking, is that something that, I mean, like, right, because also it's a different
It
thing
is
to be.
sustainable.
It's different to be a probation officer than it is to be a probation officer focused on a drug court case that takes 2 years of intensive work and you have a graduation.
Right, but they're not
It's
spending
different.
8 hours a week with that person.
It's still a different job
Yes.
that had a uniquely positioned person
But
that
did you
now
hear
has
the
quit.
caseload for the regular caseload is higher? So it's reduced with
But that
the
doesn't,
mental health
that
part.
doesn't mean it's equal. There was a person who was paid a full-time salary and wage to do this job for these 20 people that now no longer exists. So that was either a waste of money, space, and time of a staff person for years at the state level for hundreds of drug court probation officers, or they're figuring out how to make the best of it, and we could ask them how we could be more supportive of them, which is what I was building to. So I'm giving you the space and time, Amy, to tell us if and how we can best support those 20 participants and the ones in the future to be given adequate and supportive services.
Yeah, and my honest answer is, and again, we've talked about this extensively. The judges and I have met to talk about this extensively, and we do think this is the best way to give the support, get the support to the participants that they need. So we have not always been at 20 people, so I certainly don't want to say that this has been a wasted resource for years. We have, over the past 2 to 3 years, noticed a steady decline in our program. At one point, we were twice the size that we are. And so we are trying to stay on top of those trends. And, to be honest, a 20-person caseload really isn't enough to sustain a full-time probation officer. We're trying to be mindful of the resources we get from the state, and again, not having to be in a position where we have to show up to the board mid-year and say we don't have enough funding, as have been, the scenarios in the past, that we don't have enough funding to continue this full-time person in the grant position. So we're trying to be mindful of that and allocate all of our resources to the best of our ability. And I can, certainly tell you that, because I'm also the program coordinator, and I can certainly tell you that from what I have seen, this is the most efficient way this program has been run. I am actually very proud of this. I think that going forward, it is going to be very sustainable. When you have a probation officer that leaves, and a lot of times, we didn't have anyone internally that wanted to do this full time, like I said, so we didn't have the option to have an existing probation officer move into the grant funded position. So we pull someone externally. And it's a lot of training to get them into that position. And a lot of times, because, whether it's true or not, there's a perception that grant funded positions aren't as stable as a traditional position. So a lot of times this grant funded position is a stepping stone for probation officers, which is what we were seeing. So then there's the turnover. So the participants then have to see a different probation officer while we interview someone else and get that person trained. And that is not at all beneficial for the participant. So, having these 2 committed probation officers, manage their caseloads, manage them very well, I think is actually very sustainable going forward.
Thank you. I see Commissioner Cavell visiting Rochester Hills in the near future.
I've been court watching with
You're
Judge,
very welcome,
wait,
Commissioner.
I've been court watching with Judge Nicholson's court and understand why there has been the steady reduction in drug court cases. So this is not Amy's fault, this is not the probation officer's fault. This is higher up than that. And so I will not be supporting this because I understand the systemic problem here that Amy is making the best circumstance of.
Well, thank you. We are each entitled to our opinions. That's what we're here for, and I'm going to support this. Any other comments? All right, prompt the vote, please.
You have 5 yeas, 1 nay.
All right, motion carries. Thank you.
Thank you, Commissioners.
See you in a year. All right, our next item is from the 52nd First District Court in Novi, a grant acceptance from the State Court Administrative Office for the fiscal year 2023 Michigan Drug Court Grant Program. I have a motion by Commissioner McGilvery, support from Commissioner Hoffman, and we have Alexandra Black here to talk about this. Welcome.
Good morning. Can you guys hear me okay?
Yes.
Okay, thank you so much for having me today. So we have another grant. This is a continuation of the grant we've had in place for a long time. We're really excited because we received $101,000 this year to cover the cost of our full-time probation officer who does supervise the defendants. We do have here our sobriety court program, which is not grant funded. We've become fully sustainable on that years and years ago. But this drug court program that was an offshoot of our sobriety court program has a max participation level of 32 cases, which a full-time probation officer does need to oversee because of the level of supervision that they need. We have just a little bit of data because I'm kind of proud of it. I want to share this. And our State Court Administrator's Office tracks our success rate and our recidivism rate, which is recidivism looking at convictions, light convictions, alcohol and drug related convictions, 3 years out compared to other local match pairs. So that's other people from the area that they matched them with that didn't go into sobriety or drug court. Our recidivism rate is 8% versus the local matched pairs of 31%. So if they complete our program and graduate, the chances of the recidivism, well, the recidivism rate is 8% 3 years out post-graduation. So we're really proud of that because a lot of our drug court participants are highly addicted opiate users. So that's a pretty big deal. And then statewide, compared to statewide numbers, we're at 6% recidivism and compared to the statewide recidivism rate of 19%. So those are big achievements for us. We're continuing, fight the good fight here, but the $101,000 will allow us to cover the full cost of the probation officer, whereas last year and the year before, they didn't give us quite enough to cover it, and we had to come back. We had to ask for matched funds from our regular budget, and we don't have to do that this year. So we're very excited.
Thank you. Any other comments? So your comments gave us a general idea. If one full-time person works 32 cases and a part-time person works 10 cases, so that does make a difference.
Right.
All right, prompt the vote, please.
You have 6 yeas, 0 nays.
All right, motion carries. The next item is also from the 52nd First District Court in Novi, a grant acceptance from the State Court Administrative Office for the fiscal year 2023 Michigan Mental Health Court Grant Program. I have a motion by Commissioner Hoffman, support from Commissioner McGilvery, and Alexandra, you're right here again.
Yep, I'm right here again. And shout out to Commissioner Cavell, we talked about this program, 3 years ago or whatever it was, and here we are, second year of a grant. We received 34,000, oh, sorry. I have to toggle. I have so many things open right now. So many things to talk about today. 31,543. We were hoping it would be more, but they decided that because we weren't able to use, well, we used all our funds last year, but we weren't able to go over that and demonstrate that to them because we couldn't hire a liaison, a mental health liaison, without having money to do so. So we've had I had a little tiff with State Court Minister's office over this and said, if we don't have the money, people are a little hesitant to take a job when there's no money to pay for it. But they've assured us that if, when we come back in front of them, that we can, after the first quarter, we can ask for reallocation. So what we have done is we finally hired a mental health liaison through Community Mental Health, and that person, like one of the really important things about this person is normally if you put somebody in the program and you want to get them evaluated and get a diagnosis, it would take 60 days just to even get the evaluation done. And then of course you got to wait for the report to come out and the diagnosis. So with this liaison being in place and being a part of our program, we cut that down to a week. So that's the most important thing with a lot of these cases is to get them in as soon as possible. We've done a lot of outreach to the local departments, and I'm sure that a lot of you remember that this is not just a 50-1 program. This is a 52nd program, but we do accept from all other courts. We would take anyone into our program that qualifies. So right now we have 20 participants. Our max is 25. We do think we will max out this year. We're really excited because we're hoping to have our first graduation in June, and we'd like to have it there actually at the Board of Commissioners auditorium to invite everyone and to have all the 52nd judges come and anybody who's interested. And anybody who's been to a graduation, I know Commissioner Cavell has, and Commissioner Markham, they're really moving and really interesting to see. So, anyway, we want to accept this money and move forward with our liaison and continue the great services that we've been able to provide so far.
Thank you. Comments? All right, prompt the vote, please.
You have 60 yeas, 0 nays.
Motion carries. Thank you.
If I could just say before Alex goes off, you've been awesome, Alex. What you do is great. Oh, okay.
Our next item is from the 52nd First District Court in Novi, the interlocal agreement with the Oakland Community Health Network for mental health services and substance use disorder services. So I have a motion by Commissioner Cavell and support from Commissioner Hoffman. Thank you. We're ready.
Okay, so the interlocal agreement is what allows us to have our relationship with community mental health and hire this liaison. I know you're familiar with other interlocal agreements, but this is the one specifically related to what we just discussed.
Is this a part-time position?
No, it's full-time.
Thank you. And Commissioner Cavell?
I just want to say Alex is awesome and your foresight is fantastic. Okay.
Thank you so much. I appreciate you sliding that in there. Thank you.
All right, prompt the vote, please.
You have 60 yeas, 0 nays.
Motion carries. All right, next item from the 52nd First District Court in Novi is a resolution appointing Louis Langham as a magistrate of the 52nd First Division District Court. I have a motion by Commissioner Hoffman and support from Commissioner McGilvery.
Okay, and it's me again, and joining me is Mr. Langham. He is he's an attorney that has been actually here for doing a lot of MIDC work. at our court. So I think you have his resume, which is extremely impressive. And one of the things that really drew us to him, besides the great work that he does representing people here, he's a law professor. He was a Michigan State Police trooper. He's got a good balance, which is what we're looking for. The reason we need another magistrate is because the magistrates that we hire, none of them are retired. So this is a second job for them. And we want to make sure that we have all of our hours covered here during the week. And on top of that, Mr. Langham is going to be joining our our weekend arraignment program, which we've discussed before. We need really good, well-balanced, well-versed in the law type of magistrates. And we've chosen to have people who are actively practicing so that they're really up on the changes in the law, which continue obviously all the time. But right now, the temperature of things right now, things have continuously changed, and he is very well-versed. Like I said, you can see from his resume, it's very impressive, and we're really excited that he would choose to be a part-time magistrate here. We don't have a lot of very regular hours to offer him right now, except for then the weekends. And he would like to do that in lieu of being our MIDC attorney, even though he would really make more money doing that. But I think he's really interested in the service to the community.
Thank you. I am impressed. You retired after 25 years with the Michigan State Police. So
Thank you. Good morning, everyone. Sorry about that. Good morning, all. Good afternoon, I should say.
Good morning. Yeah, good morning. You have such a wealth of experience serving people and a desire to continue to serve people. So thank you.
Thank you.
Any other comments or questions? Commissioner Cavell?
Yeah, when I was looking at your resume, did you go to law school after being a state trooper? Or I was trying to do the math. Yeah,
actually, I was full-time state police. I was a detective lieutenant at the time. I was in narcotics and a bunch of other divisions. But no, I went to law school every Saturday and Sunday for 3 years straight until I graduated.
Damn,
and I worked Monday through Fridays.
Wow, okay.
Anything else? Welcome aboard. Well, wait. Well,
Yeah.
prompt the vote, please.
You have 6 yeas, 0 nays.
All right, motion carries. Definitely welcome aboard.
Thank you, now.
Thank you.
Appreciate it.
All right, our last item is from Public Services, Children's Village, a resolution supporting available additional wage increase for qualified position classifications from the Michigan Department of Health and Human Services. So I have a motion by Commissioner Cavell, support from Commissioner Powell. And Barb Henke is here to speak to this item, and you've been here with us before the meeting started, so thank you for staying.
Yes, thank you. It's always interesting to hear about what's going on in the other departments. So thank you for indulging me and adding me to the agenda. My name is Barb Henke. I'm the Director of Public Services. And I know it's late, but if you'll indulge me just a minute, just some background of why this is so time sensitive. So back in September of 2021, the legislature approved a supplemental appropriations bill, which included a number of increases for certain direct care workers. So direct care workers in adult foster care, in medical nursing homes, medical care facilities, and child caring institutions. Unfortunately, when that correspondence went out back in December, individuals from Children's Village were told that we would not qualify for that reimbursement because we were not a private child care institution. So fast forward to September of this year, September 6th, correspondence came through from the Department of Health and Human Services about how agencies could apply for this reimbursement. That's when it came to my attention. I felt after pulling the the bill and looking at all the legislation that we would indeed be eligible. And so that began the trek of a month-long back and forth with the state, trying to determine if we were indeed eligible for this money. It was deemed that we are eligible for the money. So this is a $2 increase for hours worked for direct care workers at child caring institutions. Unfortunately, not all of our employees will be receiving it because of the auditing procedures that we have to go through and what's termed as a direct care worker. However, in the resolution, you'll see it's our Youth Specialist 1, Youth Specialist 2, Youth Specialist Supervisors, and the Children's Village Program Supervisors. So we are still in the process of working with payroll and fiscal services. They've done a phenomenal job of pulling everyone that's eligible, detracting the hours that they can't be paid for, which would be vacation time, conference leave, those types of things, and trying to get this together so we can get these checks out to individuals. So basically, we're asking for authorization to do that and then to apply for the reimbursement. We have to have all the reimbursement into the state prior to the end of the year. And to apply for the reimbursement, we have to pay the people first. So that's why this has become so time sensitive, and we're trying to get this done as quickly as possible.
Is this for the present fiscal year only, or is it 2021 and 2022?
It's only for fiscal year 22 hours worked during that.
Okay, thank you. Any other questions or comments? What a nice thing we'd be able to do for employees.
The employees at Children's Village have put up with a lot. It's obviously a 24/7, working holidays, working through, on weekends, working through all the licensing requirements that are coming down from the state, being mandated during COVID. So yes, this is something that we really would like to be able to do for those employees.
Thank you. All right, prompt the vote, please.
You have 6 yeas, 0 nays.
Motion carries. Thank you.
Thank you so much.
All right, we are moved to our second public comment. Is there anyone from the public wishing to comment?
Thank you, Chief.
Seeing none, public comment is closed, and I will adjourn this meeting at 12:36. Thank you, everybody.
Oh, you're welcome.